Every 40 seconds, someone in the United States has a stroke. That is fast. By the time I finish this sentence, another brain has been hit. Nearly 6 million deaths a year worldwide. Second leading cause of death on the planet. Number one reason people end up permanently disabled. But here is the part that does not get said clearly enough. In most cases, the brain sends you specific warnings, hours, sometimes days before the major stroke arrives. Warnings that feel mild, warnings that disappear on their own, warnings that most people brush off as tiredness, stress, or just getting older. And here is what makes this even more dangerous. Even when people do recognize something is wrong and go to the emergency room, research shows that these warning events are misdiagnosed up to 60% of the time in hospital settings. 60%. My name is Dr. Kemi Lawson. For more than 15 years, I've worked in a community clinic, and most of that time, I've watched the same thing happen. People who walked out of an appointment with a prescription, but never the full picture, and paid for it later. This video is about those warnings, what they look like, why they vanish, and what to say at the emergency room so no one sends you home too early. Tell me in the comments, how old are you, and has anyone close to you ever had a stroke or a mini stroke? Whether you are 58, 72, or 85, I read every single comment. So what is actually going on inside your brain in the days before a major stroke? Most strokes, about 87%, are ischemic. That means a clot forms inside a narrowed artery in the brain, or a clot travels from somewhere else, like the heart, and lodges in a brain vessel. The brain tissue downstream of that blockage stops getting oxygen, and brain cells start dying within minutes if flow is not restored. Think of the blood vessels feeding your brain like a network of small rivers. When a dam forms, even briefly, everything downstream goes dry. Fields die, crops fail, and the longer that dam holds, the more damage you cannot undo. But here is what most people do not realize. The majority of major strokes do not happen out of nowhere. They are frequently preceded by something called a transient ischemic attack. Doctors call it a TIA. A study published in the journal Neurology examined over 2,400 stroke patients and found that warning signs appeared as early as 7 days before the stroke. In that study, about 1 in 4 patients had a TIA before their major stroke, with 17% occurring on the same day, 9% the day before, and 43% within the preceding week. A TIA happens when a clot briefly blocks blood flow, causes stroke symptoms for a few minutes, sometimes up to an hour, and then dissolves on its own. Think of it like a power flicker in your house. The lights go out, come back on, everything seems fine. But a power flicker usually means there is a wiring problem you have not found yet. Same idea here. The brain recovers, the symptoms disappear, you feel fine again. That is the most dangerous moment in stroke medicine, because when the symptoms disappear, most people do nothing. So what do these warnings actually feel like? There are 5. And the last one I share with you today is the one that fools almost everyone. The first warning is the most common and the most documented. It appears suddenly, typically on one side of the body only. The corner of your mouth droops. One arm feels heavy, or it just will not rise when you try to lift it. One leg drags when you walk. Your hand feels clumsy. You drop a cup, you fumble your keys, and you cannot explain why. The critical word here is sudden. This is not the gradual ache of arthritis. This is not the familiar tiredness of a long day. This comes on in seconds with no warning. Imagine turning on a faucet and getting full pressure. Then in 1 second, it drops to a trickle. That is what happens to blood flow in the part of your brain that controls that arm or that leg. 1 second, full function. Next second, something is off. Now you might be thinking, I get a numb arm sometimes when I sleep on it wrong. That is different. That numbness builds slowly, and you know the cause. This comes on in seconds with no explanation. And that distinction matters more than you realize. If this happens to you, call emergency services right away. And here is what I want you to remember. Do not wait to see if it gets better on its own. Getting better on its own is exactly what a TIA does. That is not reassurance. That is a countdown. One more thing before we move on. When you finally get to that emergency room, there's a single sentence, and I mean one sentence, that changes how seriously they take you. I'll hand you the exact words near the end. Stay with me. But the next warning is harder to catch because it attacks the very thing you need to call for help. This one is frightening to witness. A person suddenly cannot find the right words. They speak in garbled or confused sentences, or they cannot understand what is being said to them, even though they seem alert. They try to respond, and what comes out does not connect to the question. Or they know exactly what they want to say, but the path between their brain and their mouth has been cut. This one has a name, aphasia. What it really means is simple. Blood flow to the language centers of the brain, which in most people sit on the left side, got cut off for a moment. It is like knowing the answer is right there, right on the tip of your tongue, but the door between the thought and the word has been shut. And then a few minutes later, the door opens again. You can talk normally. You feel fine. So what do? Most people do nothing. They tell themselves it was a strange moment and move on. But here is something that needs to be said. This is one of the most reliable pre-stroke warnings in clinical medicine. And yet, when it lasts only a few minutes and resolves, it is one of the most commonly dismissed, not just by families, sometimes by the professionals who should recognize it. If this happens once and resolves, it is a TIA until proven otherwise. That means emergency evaluation. Same day. The third warning affects something you use every moment of every day. And when it goes wrong, most people blame their glasses. The third warning hits your eyes, and because it comes and goes, most people chalk it up to needing new glasses or just being tired. What it looks like, sudden blurring in one eye, a portion of your visual field going dark or gray, like someone slowly pulling a shade down across your sight. Some people lose vision in one eye entirely for a few seconds. Others get double vision that appeared out of nowhere. No head movement, no position change, nothing to explain it. Your vision is processed in an area at the back of your brain called the occipital cortex, basically your brain screen, where everything you see gets assembled into a picture. But it also depends on blood flow through the arteries feeding the eye itself. When vision goes suddenly in one eye, that is often a sign that the carotid artery, the big artery on that side of your neck, has a problem. Narrowing, plaque buildup, a clot forming. There's a fancy name for it, amaurosis fugax. Strip away the Latin and it's just a TIA that hits the eye instead of the brain. Makes sense, right? Remember that word, carotid. It is going to come up again when I tell you what to say at the emergency room. Now, the fourth warning is the most violent. It hits like nothing you have ever felt before. Okay, real quick. If this is making sense to you and you want more videos like this, subscribe. That one click is the single best way to make sure this information finds the people who actually need it. Now back to the warnings. Not all strokes are caused by a clot. Some happen when a blood vessel inside the brain actually bursts. Doctors call these hemorrhagic strokes, and they often begin with a headache unlike anything you have ever experienced. People describe it as the worst headache of their life. Full intensity, maximum pain, in seconds. Not the slow buildup of a tension headache, not the throbbing of a migraine you have had before. This reaches its peak almost instantly. Doctors call it a thunderclap headache, and the name fits. So how do you know this is not just a bad headache? Here is the key, the speed. A tension headache builds over minutes or hours. A thunderclap headache reaches full severity in seconds. There is nothing gradual about it. If someone you know or you yourself develops a sudden severe headache that feels unlike anything before, that is a medical emergency. Do not take a painkiller and lie down. Get evaluated immediately. But the fifth warning, this is the one I said fools almost everyone, because by itself it looks completely harmless. This is the one, the warning that fools almost everyone. You suddenly stumble. You veer to one side when walking. The floor feels like it is tilting under your feet, and there is no reason for it. The cerebellum and the brainstem, structures at the back and base of your brain, control your coordination, your balance, your ability to walk in a straight line. Think of them as your brain's gyroscope, the part that keeps everything level and steady. When blood flow to these areas gets interrupted even briefly, things go sideways, literally. Now, you might think, my balance is not what it used to be. I stumble sometimes. That is fair. But here's the difference. Age-related balance changes happen gradually, over months and years. You adapt. You compensate. This is different. This comes on in a moment. No positional change, no clear trigger. 1 second you are steady. The next, the ground is not where it should be. And when this shows up alongside any other warning on this list, the weakness, the speech, the vision, that combination is about as clear a signal as the brain can send. Okay, so you now know the 5 warnings. But I want to tell you about someone who knew the warnings too. She noticed them. She went to the hospital, and the system still failed her. Let me tell you about someone I'll call Carol. 69 years old, a retired librarian who lived on her own just outside Sacramento. One evening after dinner, her right hand went numb enough that she dropped her teacup. 10 minutes later, it passed, and she felt completely normal again, like the whole thing had never happened. But Carol had seen something like this before, in a friend from her book club who'd had a stroke 2 years earlier. So she didn't brush it off. She drove herself to the emergency room that same night. The ER was busy. She waited. When she was finally seen, they ran some basic tests, told her it was likely anxiety, possibly a pinched nerve, and sent her home with instructions to follow up with her doctor the next week. The next morning, Carol woke up unable to move the entire right side of her body. Full ischemic stroke. She spent 3 weeks in the hospital and months in rehabilitation. She regained about 70% of her mobility after 4 months of rehabilitation. But her independence, the thing she had built her entire retirement around, was permanently changed. She moved in with her daughter. She never drove again. Here's what stays with me. Carol told me afterward, in my own clinic, I did everything right. I drove myself in. I just didn't know what to ask for. That last sentence is the reason I am making this next part of the video, because recognizing the signs is only half of it. You also have to know what to demand when you get there, so that no one sends you home the way they sent Carol home. You have probably heard of FAST, face, arm, speech, time. I want you to learn one step better. Be fast. The B is for balance. The E is for eyes. Balance, that sudden stumble we talked about. Eyes, the vision that drops out in one eye. Face drooping on one side. Arm weakness. One arm drifts down when both go up. Speech that comes out slurred or strange. And T, time to call emergency services right now. Notice something? Those 6 letters are the 5 warnings I just walked you through. That is not a coincidence. Here's a 30-second check you can do right now while you're watching. Smile at your screen. Lift both arms over your head. Say one full sentence out loud. Easy? Good. But if any one of those ever feels wrong and comes on out of nowhere, you already know what it means. Fast is good. It helps you recognize a stroke. But here's the part no one covers. FAST tells you how to spot a stroke. It does not tell you what to do when you arrive at the hospital. And that gap, that silence between call 911 and what happens next, is where people like Carol fall through. So let me give you the words. If you or someone you love arrives at the emergency room after any of the symptoms I just described, even if the symptoms have already resolved, say this. I experienced stroke symptoms that came on suddenly and then resolved. I believe I had a TIA. I need a full TIA workup today. Then ask for 3 tests by name. First, a carotid duplex ultrasound. Remember that word from earlier? This checks the arteries in your neck, the ones feeding your brain, for narrowing or plaque buildup. Second, an echocardiogram. This checks your heart for clots or rhythm problems that could send a clot up to the brain. Third, a CT angiogram. This gives a detailed picture of the blood vessels inside your brain itself. Write these 3 names down right now. Put them in your phone. Stick them on your refrigerator. Because if you ever need them, you are not going to be in a state of mind to remember. Your doctor may order additional tests depending on your situation, and that is a good thing. But these 3 are where any serious TIA evaluation should start. I am telling you this because this is the conversation that should happen in the clinic, but almost never does. There is not enough time. So I am giving you that time right now. Most stroke videos tell you to recognize the signs, and that matters. It genuinely does. But recognition without action, without knowing what to demand, is not enough. Carol recognized her signs. She went to the hospital. What she did not have were the words, "Now you do." So here's where you stand. You've got the 5 warnings, and be fast to catch them quick. But the thing that really tips the scales is those 3 test names. That's what sits between getting sent home and getting saved. Think about the person in your life who would brush off a numb hand, who would go to sleep instead of going to the hospital, or, and this is the part that gets me, who would go to the hospital and accept the first answer they are given. Send them this video. They need this information before the moment arrives, not during it. If this gave you something useful today, subscribe. I cover topics like this every week, the things that should come up in your doctor's visit but rarely do. I'm Dr. Kemi Lawson. Your brain does warn you. Now you know how to listen, and you know what to say so no one waves you off. I'll see you in the next one.